Hey everyone, it's Drew here, back again at VCS 2017, joined by Dr. Pearlman from New York. He's a facial plastic surgeon. Thanks for joining us.
Thanks for having me.
So how's the show going so far?
This is my favorite show of the year. I've been doing this meeting since it started.
Oh, wow.
And it's really, I look forward to it every year, and I always learn more than any other meeting I've ever gone to.
Cool. So talk a little bit about the program. What kind of sessions have you attended so far?
Well, I coordinate the entire rhinoplasty section, so
Really?
It's 3 half days of rhinoplasty. We're not going to learn everything there is about rhinoplasty in 3 days, but we try to pick literally international speakers that have the most they can contribute. We pick specific areas to address so we can get anywhere from beginner to advanced, so that any rhinoplasty surgeon can learn something out of the session, including me.
Great. I like it. So what is it about this conference that you think makes it different than other ones?
You know, this is truly a multidisciplinary conference, and it was set up so that there are equal attendees and lecturers from plastic surgery, facial plastic surgery, dermatology, and oculoplastic surgery. So all 4 core specialties that practice facial rejuvenation can get together to discuss ideas and see how each of us approach a specific area differently.
Right. That's great. I love it. That's what everybody's been saying so far. The multi-specialty, collaborating with everybody. Even there's a good amount of international speakers here as well and attendees, right?
Yeah, absolutely are.
How,
yes.
how does that now, because people do things differently across the different countries, right? And is that...
Well, the Europeans have a lot to add because they have products and fillers that are not approved in the United States yet, and many of these products are things that we're going to be seeing within the next year, 2 or 3.
Gotcha.
And stuff that they presented 3 or 4 years ago are now state-of-the-art currently. So it's good to have these people here that can show us what's coming down the line.
Sure, yeah, cool. I like that. That's cool. All right, well, let's shift gears here a little bit. I'm going to ask you some personal questions,
Sure.
learn a little bit more about you. We can share this with your patients, and they can maybe learn something they don't know about you already. What's your favorite color?
That's a good question. Probably blue.
Okay.
So is
Yeah.
it a show?
Yeah, right? You look good in blue. You a sports fan?
Yes.
Favorite sport team?
It's, New York Giants.
Okay, cool, nice. What's your favorite sport? Football?
As to attend, football to watch, football to participate, golf.
Okay, nice. Are you a good golfer?
No one ever thinks they're good enough. We always want to get better.
So don't be humble. Are you good?
I think I'm pretty well. You know,
Okay.
I have a mid-teens handicap.
Okay, nice. So that's really good. It's a lot better than I am. What was the last thing you watched on TV?
Last thing was probably the basketball game.
Okay, the Cavs Warriors.
Yep.
You got a team you're rooting for? It doesn't matter.
Not really. I was watching for the fun of it because the Knicks are
Terrible.
out of it, been out of it, and will not be in it for a long time.
Why did you get into facial plastic surgery?
Well, I did actually ear, nose, and throat residency, and as a resident, we did 3 times as many nose jobs, twice as many facelifts and blepharoplasties as the plastic surgery residents.
Okay.
But yet we learned the face inside and out. Cosmetic surgery, reconstructive surgery, trauma surgery, cancer surgery. So we know this deep to superficial,
Yeah.
and I ended up doing a fellowship in facial plastic surgery to enhance my training, and it's really become my passion. It's evolved over 29 years of practice.
Oh, wow. Great. Congratulations for that. It's a big achievement. What do you love most about your job?
The chance to create. You take someone and you tell them how you're going to improve their looks, and it could be with a little filler.
Right.
To make their face look more natural, more youthful. Maybe at a young lady, create better cheekbones, and a more mature lady, restoring facial volume. Or what my love is, taking a rhinoplasty. I mean, the nose is the most prominent feature in your face.
Yeah.
You take someone who either has breathing issues or cosmetic issues or both, and you can. And the goal is to make a nose that fits them, so that they go out in public and they feel great about themselves, but doesn't scream nose job. I mean, people say, "What's natural?" Well, when my patient says, "I love the way I look, but people don't know I had surgery," that's what's natural.
Beautiful. I like it. Cool. What were you like in high school?
High school, I was a nerd. Yeah.
Well, yeah, like what kind of nerd? So studious or like
studious.
Okay.
All about academics and getting the right grades because I wanted to be a doctor since I'm 5 years old. And
Yeah.
so it was about, I knew I had to study to get into a good college and I knew I wanted to go to medical school. I knew I
Yeah.
wanted to be a doctor. So I pursued academics and math and science and humanities and it was, sports were secondary.
Cool. I like it. Last question. If you can be any kind of animal, what animal would you be? Your spirit animal.
I have no idea. It's just,
Throw one out there.
I
Do you have? Are you a cat or dog person?
dog.
Dog?
Absolutely.
Okay.
Not a cat. Not a cat person.
Okay, cool. Do you have dogs?
No. I have little kids right now. They're not old enough to care the dog, so when they get a little bit older.
Yeah. Right on. All right, cool. Awesome. Well, thank you for joining us. I really appreciate it. It was good to get to know you, and have a good rest of your show.
Thanks for having me.
You got it.